Greetings, and welcome to the Ask the Ambassador series. I'm Chidi Wamuo, a psychiatry resident at Morehouse School of Medicine and a behavioral health ambassador for the HBCU Cares initiative on the campus of Clark Atlanta University. The Ask the Ambassador series is an opportunity for you undergraduates at HBCUs to ask behavioral health ambassadors questions about careers and academic studies in behavioral health. Let's get started. The first two questions are from Ben, a senior biology major at Morehouse College. So the first question he asked was, in what ways have the pandemic, as well as quarantine, affected our mental health? And that's a great question. I think for the pandemic, we have to look at it as a medical issue. So a lot of people obviously have been sick with COVID, and that physical sickness also influences our mental health. And think of it as when you had the flu or you had a cold and you probably noticed you didn't feel like doing much. You wanted to sit in the bed, you wanted to just not talk to anyone and not do much. And that's what happens to us mentally when we're physically sick. So that's definitely one way. Another way is, of course, the loss of loved ones. We can't discount that, whether it's a friend, a family member, or even just hearing of anybody in the community struggling with the illness or even passing away. So it's influenced the grieving of America and the world, and how we overcome and continue on with life in the midst of trials. In quarantine, imposed by the pandemic, has also its own set of challenges. And that's kept us socially isolated. We've had to pivot from certain careers. We've had to adjust how, for example, how we learn, going to school in person versus virtually. And that all has effects on how we feel. There's an increased rate of burnout and just feeling less satisfied. So as we are removed from our social circles, that influences how we're living and how we're contributing to society, engaging with the world. So that definitely has impacted our mental health. So I would say those two things are negative. On a positive way, I think it's also helped people to connect with themselves, reestablish their identity, and really understand who they are on an individual level, outside of career, outside of school, as we've had time to sit back and reflect. And Ben's second question was, how can psychiatry contribute to mitigating suicide rates in young adults as a result of social media? And that is a great question. A recent study published in the Journal of the American Medical Association actually found that the suicide rate for African-American men is actually increasing, particularly younger African-American men. And this isn't limited to just African-American men. In the United States, in the rest of the world, there still is an issue with dealing with and helping to prevent suicide. So I think the way that psychiatry can help mitigate these rates is, one, helping to reduce the stigma of mental illness. Not only suicide attempts or completed suicides, but just mental illness overall. Because as people start to feel stigmatized and less comfortable going to someone to open up how they're feeling and carrying that burden, it's difficult. So once that stigma is reduced, hopefully we can catch people that are struggling earlier. I also think, and to answer the second part of this question, as a result of social media, psychiatrists really need to be during their sessions with patients, especially children and adolescents, talking with them about how social media influences behavior, and as well as their parents, how they can help their child or teenager monitor their social media use, and helping to work together to find ways to not let the negative aspects of social media impact mental health. And thirdly, I think that we can encourage patients as well to utilize social media in a positive way. Identify the ways that social media is a positive influence, but also help our patients understand the negative ways that they may not be aware of that it's attributing or contributing to their mental health. So those are great questions from Ben. And the next two questions are from one of Ben's colleagues, Chris, another senior at Morehouse College. And the first question is, what do you think is the best way to increase the number of African-American students in the field of behavioral health? That is a tremendous question. To me, the biggest way is to provide students with early exposure to the field. So we need to establish pipeline programs, not only in college, but also in high school and even middle school, to one, elucidate the ways in which people can get involved in behavioral health. So behavioral health isn't just limited to medical school, which would help you to become a psychiatrist, but there's nursing, there's social work, there's psychotherapy, there's counseling, there's a vast array of fields. And we just need to provide early exposure so that students like yourselves can get to see what kind of a day in the life is like. So I think that is the best way to increase the number. And lastly, Chris's question was, what behavioral health resources are available for people that may not have the money to afford specialty care, such as a psychiatrist or psychologist? Another great question. We know in America, health insurance and access to care and affordability of care are huge issues. And I think in terms of what behavioral health resources are available, most states have state-sponsored programs where individuals who may not have health insurance can still access care. For example, here in Atlanta, Grady Hospital System has an outpatient behavioral health clinic called Park Place, which is where people or patients, regardless of their insurance status, can still afford care. And there's grant funding that reimburses the clinic. So hopefully most states have a version of that to allow people to be able to access care. So it's just a matter of working with someone in the field, whether that's a nurse, a social worker, or just doing a Google search to identify what places accept patients that may not even have insurance. So those are great questions. And I look forward, hopefully, to hearing more questions from you all, but I wanted to say thank you, and please stay tuned for the next video in the Ask the Ambassador series. Have a great day.